Okay, well, I'm going to officially get us started. Good morning or afternoon to you, depending on where you're calling in from. I'm Laura Johns. I'm the director of the National Center on Early Childhood Quality Improvement, and we're excited to have you here for the webinar on exploring strategies to increase compensation and benefits for the early childhood education workforce, another in our series of Workforce Wednesday webinars. Again, if you're just joining us, we're excited to have you here and excited to have you introduce yourselves in the chat box. We also need to make sure that you choose the language that you'd like to listen to the webinar today. So at the bottom of your screen, you can go to the next slide. You'll see a globe and you will select what language you'd like to listen to, either English or Spanish. So again, I want to welcome the 962 of you who have joined us. And I think we'll have more people jump in. So it looks like we are doing well with numbers. So I'm going to introduce Katie Ham, who is the Deputy Assistant Secretary for the Office of Early Childhood Development and the Acting Director of the Office of Head Start Administration for Children and Families. So we are really excited, Katie, to have you here and kick off this Workforce Wednesday webinar.
Thank you so much, Laura. And thank you to all of you who are joining us today to talk about this really important topic. I can't think of anything else in the early childhood sector that is more important to talk about than compensation and benefits for our early childhood workforce right now. And I know you are all very busy people, so thank you for being here with us. I wanted to start by talking about how we're thinking about our mission and vision for early childhood at this particular point in time. This administration has been clear from the beginning that we supported increased investments for early childhood, specifically focused on increasing wages across all types of early childhood settings, including preschool, family childcare centers, Head Start. We do not currently have that investment. But what we want to do today is talk about ways that we can move the ball forward. And in order to move forward, we really need to understand what our mission and vision is for this work. So I wanted to share this slide with you today that shows how we're thinking about what we need to do in the early childhood space over the next several years. We're looking across children and families and the early childhood workforce. Obviously, the needs and the goals for each of those components are similar. In the children and family space, we're looking at safe and supportive environments that promote child development. We're looking to provide access to high quality programs that meet families' unique needs. As you know, families' needs have only heightened during the pandemic. We want to be thinking about all of the needs that families have, logistically, linguistically, culturally, financially. They have diverse needs, but all families are feeling a lot of pressure right now. And those needs are really met and supported by an early childhood workforce and a system that's able to attract, prepare, and support them through compensation, including benefits that demonstrate the value of the workforce to our communities. So today we really are going to hone in on compensation and benefits. I think that our current workforce crisis really comes down to that. When school systems, when retail, when food service, when other sectors are able to pay more, it becomes very difficult for our early childhood workforce to stay, especially in positions that are labor intensive, that are emotionally intensive, that really require a lot of them. And so that's the difficulty we find ourselves in right now. And we're going to talk about some steps forward that we are taking in the federal government and some ways that we really want to partner with all of you to move closer towards this vision. So to put a little bit more specificity on it, we are very focused on compensation. Our goal is to reach a living wage and pay parity with elementary school teachers for the early childhood sector, again, across settings. Building a pipeline to ensure a path for effective early educators, maintaining diversity. I talked in the earlier slide about all the needs that families have, the diversity of families with young children, and that requires us to maintain the diversity that we currently have in our early childhood workforce. We are also very focused on equitable access. We want to make sure that regardless of geography, regardless of race, ethnicity, disability, children have access to effective early educators. And we're also looking at high quality practices and making sure that the workforce has the skills and the supports that they need to implement it. I can imagine for many of you listening to this, this probably feels very difficult, and it probably feels very far from where you are today when we're hearing from Head Start programs, we're hearing from childcare programs, that family childcare providers are having to close their doors, that centers can't open classrooms, that Head Start programs are struggling to recruit qualified staff. And I understand that. This is an ambitious goal, but the federal government also has over $20 billion invested in early childhood. And unfortunately, that investment is too often focused on, it's too often that our federal investment is contributing to the problem, frankly, rather than addressing pay, addressing benefits, and being part of the solution. So we've taken some steps recently, and we're going to continue taking steps to make sure that that the role of the federal government and the role of the federal investment is to move forward towards this vision for the early childhood workforce so that children and families can reap all of the benefits that early childhood has to offer, and that we're paying the people who do this important work that are critical to our economy, critical to our communities, critical to children's well-being, help them thrive and support their own families. So I'm going to turn now to talking about some specific steps that we have taken, including specific steps this week, to move towards that vision. So yesterday we announced $300 million in new funding opportunities. We announced a new workforce center that is going to be focused both on research and technical assistance and supporting states, tribes, territories, local communities, including Head Start grant recipients, on strategies that can improve compensation and improve pathways for the early childhood workforce. That notice of funding opportunity went out yesterday. It's a $30 million research and technical assistance center. It's a 5-year grant that's going to fund research and TA around the recruitment and retainment of a diverse, qualified, and effective workforce. And it's going to provide direct support to states, tribes, and territories that are focused on this and are bringing their innovative and ideas to the table. We also announced that we have 2 preschool development grants that are currently out that are available to nearly all states and territories. If we want to go to the next slide. So the PDG grants, Birth to 5, it's $266 million in funding. Every state, with the exception of Wyoming and Wisconsin, since they already have grants, is able to apply either for a planning or a renewal grant. So if you look at this map, hopefully it's not too small for you to see. If the dark blue states are eligible to apply for a renewal grant, that means you already have a renewal grant, or you currently have a planning grant and you're re-upping, so that NOFO, notice of funding opportunity, is available. If you are a light blue state, that means you have not received a PDG grant before, so you can apply for your first planning grant. If you are a striped state, a striped light blue state, that means that you have already done an initial grant, you've already done a renewal grant, and you can come in for a new planning grant that'll allow you to kind of take a look at what the needs are, given what the past 2.5 years have looked like for children and families and the early childhood community, and continue some of the work and expanding some of the work that you're already doing. You'll notice some changes in those NOFOs. There's a big emphasis on the workforce, given where we are in the conversation we're having now. and also inclusive settings for children with disabilities and access to early childhood. Preschool development grant funds for those renewal grants can be used to directly support children attending programs. So there's specific information in those NOFOs about the ways in which states and territories can use these funds to support access to early childhood programs. If we want to go to the next slide, I'm going to talk a little bit more about the guidance that we put out. So over the past week or so, we've put out guidance in preschool development grants, childcare, and Head Start, all focused on how these funds can be used to support the workforce. So regardless of what type of grantee you are, if you're a state, tribe, territory, or Head Start grantee, we're hoping that you really take a look at this guidance and see what strategies apply to your funding stream or the multiple funding streams you have, and how all of that can work together for some of these strategies that we know are effective in improving compensation and benefits. We have an information memorandum out for current preschool development birth to 5 grantees with examples of how our existing grantees are using these funds for the workforce. We have examples of people doing wage studies, salary scales, retention bonuses, promoting career pathways, promoting professional development and ongoing training. The IM actually includes specific states and what they're doing, and you'll hear more from specific community and state examples today. But really encourage everyone with a PDG grant to look at what flexibilities they have in that program in this IM and different strategies for doing that. And if you're thinking of applying for a PDG grant, you can also look to this IM for ideas about what strategies you might want to pursue should you receive a grant. One important caveat on our preschool development grants, in order to undertake some of these activities, it needs to be in your scope of work. It is very easy to amend your scope of work. You just need to submit a request by September 30th, get in touch with your federal project officer, and they can answer any questions you may have. And you can look to the IM for some more specific instructions about how to do that. But make sure you get that done in the next couple of weeks so that we can get it approved before the end of the year and you can start implementing any of the workforce strategies that you see in the IM or you hear about today that you want to pursue. I also wanted to shift to talk a little bit more about Head Start as well. As many of you know, Head Start has long been our gold standard for early childhood and articulating what quality early childhood looks like. And it's really important that we are very clear that supporting well-compensated early educators, making sure that they have supports, good job and working conditions, that we're supporting their wellness. That's an incredibly important component of quality. So we have over the last year put out program guidance that really takes a deeper dive into the strategies that are needed to do this. And for those of you who are joining who are Head Start grant recipients, there is a webinar tomorrow that will go into much more depth on what this program guidance says, how to implement it, and answer any questions that you might have. So I strongly encourage you to join us tomorrow for a Head Start specific webinar. But the 3 specific pieces of program guidance that the Office of Head Start has put out in the past 3 years, the past year, the IM that was released earlier this week really instructs Head Start grant recipients to look at how they can permanently increase wages in a sustainable way. And that requires looking at program structure, looking at budget, looking at funded enrollment, and seeing what is needed to make sure classrooms are open. For a lot of programs, that is going to mean increasing wages and finding out how within your budget to do that, which could include reducing the number of children for who are enrolled. The focus should be on the community needs. So understanding what is needed to open those classrooms, to recruit those qualified staff, and what's needed for families. We know families are struggling with transportation. We know what work looks like has changed. So families might have different needs when it comes to their work. But really prioritizing what are the needs of the community and children right now. What is the operating structure? What are the wages? What are the program components that are needed in order to support that? And prioritizing Head Start for those most in need as you move through that process. As always, your regional program staff are the best people to answer any questions and talk about how to start this process. In June, the Office of Head Start released an information memorandum on competitive bonuses for the Head Start workforce, clarifying that financial incentives such as retention or recruitment bonuses can be used with either Head Start base funds or ARP COVID relief funds to provide these financial incentives. Importantly, we want folks to think both about the current staff and recruitment strategies and how financial incentives can be used to keep people in their positions and also get people in any vacant positions. And last but certainly not least, about a year ago, we released program guidance that remains very relevant on staff mental and physical health, how it shapes their engagement with children and families, job satisfaction, their likelihood of staying in the job, and their quality of life. And obviously, a staff that is well supported is also going to be better able to support high quality interactions with children. So all of those resources are available. Again, join us tomorrow and we'll do a deep dive into how to support Head Start programs in implementing some of this. And now it is my pleasure to turn things over to Ruth Friedman, the Director of the Office of Child Care. Ruth is going to talk about ARP funds and how they can be used to support the child care sector, as well as some specific information that the Office of Child Care has put out in support of this overall goal. So I will turn it over to you now, Ruth. Thank you so much.
Thank you, Katie, and good morning, everyone. I'm so happy to be with you here today. We are all here because we know a skilled child care workforce with appropriate compensation and benefits underpins a quality child care system that is accessible and reliable for working parents. Unfortunately, the pandemic devastated the already fragile child care sector. Providers had to navigate public health concerns, unstable enrollment, and higher expenses. And that translated and continues to mean we are seeing temporary closures, some permanent closures, higher costs, and staff shortages. But while the pandemic made a bad situation worse, low compensation was a problem that predates the pandemic, and it requires continued attention and investment. The challenges are significant. There's no easy fix, and I know you are all very acutely aware of that. Today, I'm going to focus on some of the important efforts going on across the country that were made possible by the $40 billion investment in child care funding in President Biden's American Rescue Plan Act. These funds really have been critical for supporting the child care workforce, child care supply, and families with young children. An emergency $29 billion child care stabilization grant program, which this slide has a little bit of data on, that began last year. It's been up and running in most states since the end of 2021 and now has been distributed to most licensed and regular child care providers across the country. Providers have been able to use these grants for a variety of operational costs like rent, utilities, salaries, benefits, goods and services. And there is just no doubt that despite the many ongoing challenges in the child care community, these investments are preventing a far greater loss of services and a far greater loss in our workforce capacity. So the data you're seeing on this slide here, this is from our administrative data that we collect quarterly from our grantees. So it's actually a little bit behind where we are today because this data shows you through the end of June. So today where we are is about 650,000 stabilization grants have gone out to more than 200,000 providers with a licensed capacity to serve 9 million children. The average award for centers has totaled about $100,000 and about $18,000 for family child care providers. All of these numbers are continuing to tick upwards as awards continue to go out in many states. These funds really have been quite important for increasing compensation in child care workers. More than half of the states required or incentivized providers to allocate a percentage of their grants to increase pay or support the workforce. The most common usage in centers that we're seeing for these funds has been personnel costs, and roughly 9 in 10 childcare centers are reporting that they are using the stabilization funding for personnel expenses. You can go to the next slide. The American Rescue Plan also included another $15 billion for supplementing the federal child care program and provided some extra flexibilities for how states, territories, and tribes can use these funds. So over the last year, what we have been seeing is they have begun using these funds, the substantial new investment, in exciting ways to support, recruit, and retain the child care workforce. Our grantees are doing things like increasing wages and providing bonuses, connecting workers to health insurance. They're increasing and improving provider payments, and they are also making efforts to support professional development. The slide here is showing just some of the critical ways that states, territories, and tribes have been using this funding. But because states needed to first focus on getting their stabilization grant programs up and running, states are really just now turning their attention to the $15 billion pot of childcare funding. So it creates a really important opportunity for the field to move forward in ways that can help meet the current challenges we're facing. Next slide. That's one reason why the Office of Child Care released more guidance just this week on how existing federal child care funds can be used to raise child care staff compensation. We are strongly encouraging our state, territory, and tribal grantees to use these child care funds to provide financial incentives and compensation, to do things like increase provider payment rates, contract with CCDF child care providers in order to pay for child care slots or entire classrooms, or offer provider level grants that can support high quality care for all children, including appropriate compensation in those grants. We are recommending providing direct and ongoing bonuses or wage supplements, taking action like connecting family child care providers and center-based staff to health insurance, or support on premiums in the marketplace, and access to paid sick leave. These are all really important things that we would like to see states, territories, and tribes moving forward on to meet our current challenges with this historical investment they still have available to them. Supporting post-secondary education through student loan debt relief or loan repayments, scholarships, you bumped forward, or tuition support is also important. So I'm going to close out to make sure everyone is aware of some very important opportunities in that space right now. So earlier this year, the Biden administration announced changes to the public service loan forgiveness program for a limited time because of the national emergency. Because of this limited flexibility, many early educators and anyone working in government or nonprofit settings will be eligible for student loan forgiveness, even if they were not eligible before. Some borrowers, however, will need to consolidate their loans and submit their forms by October 31st of this year in order to be able to take advantage of this opportunity. So we are asking you that you share this time limited opportunity with your networks, apply yourself if you're eligible, but this all does need to happen soon. We had over 17,000 people view the live stream or the recording of our joint webinar with the Department of Education on this topic, which I think really demonstrates the incredibly strong demand for relief from student loans among the ECE workforce. We also, so that you know, we've developed a one-pager that includes information specific about this to the ECE workforce. I think someone is going to put that in the chat for us. We also have a toolkit, so please, please help spread the word. Next slide. And finally, President Biden also very recently announced up to $20,000 in debt cancellation for Pell Grant recipients with loans held by the Department of Education, and up to $10,000 in debt cancellation to non-Pell Grant recipients. Borrowers are eligible for this relief if their individual income is less than $125,000 and under $250,000 for married couples. It is really important that educators are aware of this opportunity, especially if they are not eligible for public service loan forgiveness. So again, please help us get the word out. I am now going to pass the session back to Laura Johns so we can move to our terrific panel. We've designed this panel today to provide important examples of some of the effective strategies that we're seeing in action in states and local programs. We hope you will work with your state leaders to use the funding opportunities I've discussed and Katie's discussed that are available right now to move us forward on the workforce crisis. I am looking forward to continuing to work in partnership with all of you to make progress on these essential goals and build a pipeline of qualified early educators who are appropriately compensated for the essential work they do every day. And Laura, I'll send it back to you. Thank you very much.
Thank you. Thank you, Ruth. Thank you, Katie, for all this exciting news and for all the support that you provide all of us. So we are excited to have 3 panelists today. We're going to have Janice King, who is the Executive Director of Head Start, Inc. in Montana, joining us via a video. Andrea Day, the Director of the Division of Child Care in Kentucky, sharing one of her initiatives, and Natalie Nachtigal, who is the Business Application Support Specialist of the Child Development Division of Department for Children and Families in Vermont. So I'm excited to turn it over to them. I do want to say before we start the video that a lot of you are asking some great questions, and we will make sure that you get links to additional webinars that will help you answer those questions. So with that, we will pass it on to Janice King via video.
One moment.
My name is Janice King, and I'm Executive Director of Head Start, Inc., based out of Billings, Montana. We serve 360 children and their families in Yellowstone and Carbon counties. For many years, we've had a somewhat comprehensive benefits package that is pretty typical. We contribute monthly towards our employees' medical, dental, and vision benefits. And we also contribute and match up to 3% of contributions in a 401k retirement plan for our employees. But we really took the time to analyze our workforce and try to understand employee turnover, what was retaining employees. We pulse surveyed our employees, we listened to their feedback, and really tried to come up with an enhanced compensation plan that really met the needs of those that we were employing. One of the things we discovered is we employ about 95% of our employees are female, and many of them are young females who may be starting a family of their own or raising a family of their own. And so in working with our insurance provider, which is Blue Cross Blue Shield in Montana, we were able to use some quality improvement funds to invest in a plan that includes short-term disability benefits, long-term disability benefits, and resource services for our employees. In a nutshell, those short-term disability benefits include up to 8 weeks paid leave at 60% for our employees who deliver a baby. We also, it covers up to 12 weeks, 60% of wages for illness or injury, which has really been crucial in times of COVID, and some people have gotten significantly sick with that. The resource services that come with that include face-to-face counseling. There's telephonic counseling for those that aren't as comfortable talking face-to-face, but there's also web-based services, and those web-based services cover everything from supporting you through divorce, debt relief, saving money, natural life transitions like college or getting ready for retirement. And so those benefits coupled with we use a local clinic here in Billings that provides face-to-face counseling that we call employee assistance programming as well. Those have been very cost effective and have really helped. Over the course of the last few years, we were looking at over 60% employee turnover, and mostly in our education department. And this last calendar year, we were able to reduce turnover to 17%. So we're really proud of that. We used our ARP funds to provide retention stipends for our staff. And so last year, we provided a retention stipend based on years of service, so longevity with the organization. This fall, we are using the good chunk of our ARP funds that are left to provide a retention stipend based on the number of hours each employee worked in the last calendar year. So if an employee was here every day and worked hard, they're actually getting a little bit larger bonus than those that maybe aren't as higher performing or haven't been able to be in the work every day. So really taking it into account that you know, this job is taxing. People are showing up, it's physically and mentally taxing, and really rewarding them the best we can for the time they put in with the agency in the last year. The other thing we did in supporting the desire for our community to become healthy and safe during times of COVID. We educated our employees with all the resources that were provided by the Office of Head Start, but also provided a stipend with our ARP funds for employees who got vaccinated. And that include first vaccination, second vaccination, and the booster. I believe, or we believe as a program, that the employee benefits packages, you know, healthcare, access to mental health services, payment if you're out from work due to illness or medical reasons, are just part of what makes us successful in retaining employees. The other piece is really tapping into that human side of the work we do, right? Our employees have become our most precious resource, as right along with children and families. You know, Head Start's always had a great philosophy around supporting children and families, but we also have to support our employees. And sometimes, many times, many of our employees are Head Start families, and that's what Head Start's about. So treating our employees with the same dignity, respect, offering resources that we can, just like we do for children and families.
Awesome. So huge thanks to Janice for taping some remarks for us about the great work that she's doing. And it was great to see all the kudos to her in the chat box. So thank you everyone for that. We'll make sure we pass those along to Janice. So next up we have Team Kentucky, and Andrea is going to be sharing a little bit about their initiatives. Take it away, Andrea.
Thank you very much for allowing me to come and kind of spotlight some of the work Kentucky's been doing over the past few months. We have really put a strong emphasis on supporting our workforce as a whole. And some of those things are, we have started paying for all the background checks for anyone working in our centers, paying for first aid, CPR, trainings. We've offered resiliency and trauma-informed training for not only staff, for themselves, but also to make them more, to allow them to work with children who have also experienced the trauma of the COVID days. We have also sponsored scholarships for anyone working in the ECE task force. We are paying for them to get a certificate, credential, associate's, bachelor's, or master's degree, as long as they work 20 hours in a program. We also have partnered with our Governor's Office of Early Childhood to help them promote their apprenticeship program. And then we have also expanded our subsidy income eligibility. We were at 160% of the federal poverty guideline. We moved to 200% earlier this year. And in July of this year, we moved to 85% of the SMI, making more folks eligible. And the newest thing that we have on board, if you will, is in October 24th to be exact, we are adding a protected population to our child care assistance program. So what that means is anyone who is working in a licensed or certified child care program in our state and meet the technical eligibilities of the subsidy program, their income will be excluded and they will be eligible for CCAP. So their child care will be paid for just because they are working in that center at least 20 hours per week. And our thought process behind that was we saw a great reduction in the amount of families that we were serving. We are slowly recovering to our pre-pandemic numbers. However, a lot of our programs are suffering and they've not been able to open all their classrooms back up because they don't have folks to work in those programs. They're working in retail or hospitality. So we saw this as a benefit to not only our workforce, but also our providers. It's an additional benefit that can be provided at no cost to our providers who are already struggling to make ends meet and to keep their programs running. We don't know how many folks this will impact because like I said, we did just raise our income eligibility guidelines to 85% of SMI. So given that many childcare providers make a lower wage, we think that a lot of those families are going to qualify now at that threshold, but we wanted to make sure that those that maybe just, because of a spouse or partner's income exceeded that they would still have the opportunity to have their child care paid for. So we're very excited. We want to share all the information that we have as soon as we have it. But like I said, this is something that launches October 24th. So there will be lots of good news hopefully to come that I will be able to share with our partners and with the rest of you as we have it. So I appreciate the opportunity to share what we're doing in Kentucky.
Thank you so much. And now we're going to turn it over to the state of Vermont. Natalie.
Hello, thank you. Hello, everyone. My name is Natalie Noctigal. I'm the Business Application Support Specialist with the Department of Children and Families Child Development Division in the state of Vermont. My title doesn't make my position very clear, but I function as the program manager for child care quality and workforce development programs that are currently funded by the American Rescue Plan Act, or ARPA discretionary funds. Today, I'll just be highlighting one of those programs that we've started this year. One of those workforce development programs that started in January is our Student Loan Repayment Assistance Program. This program is administered by our state NACI chapter, the Vermont Association for the Education of Young Children, or Vermont AUIC. I think we're on the right slide, so that works. So the development of this program was guided by stakeholder feedback and data we collected by a survey that was administered to the field by the Vermont State Advisory Council. And this survey highlighted challenges that the field recognized for remaining and entering into the field of early childhood education. Among those top identified barriers to the field was the cost of higher education and the burden of student loan debt. So in June 2021, and I apologize, the slide says May, in June 2021, Governor Scott and the Vermont State Legislature approved a bill that would provide historic financial supports to the early childhood education workforce and recognize early care and education as essential work throughout the state. This bill, entitled Act 45, includes the Student Loan Repayment Assistance Program and 2 additional scholarship programs to help reduce the barrier of higher education costs and increase workforce retention. Next slide, please. So the Student Loan Repayment Assistance Program provides up to $4,000 annually to each qualified participant, reducing the student loan debt of full-time educators who earned an early childhood specific degree within the last 5 years. Awards are given on a first come, first served basis. Applications opened in May of this year and will continue to be accepted until grant funds are expended. The program is currently funded with ARPA discretionary dollars, but we intend to fund this program over multiple years. Eligibility for this program centers around supporting early childhood educators with the highest education costs at the lowest wages, which currently limits the program to graduates within the last 5 years that are just starting their career. Additional eligibility requirements include qualifying early childhood education degree concentrations, annual ECE salary, and the continuation to work within a regulated, privately operated childcare center or family childcare home. Prospective participants start by filling out an inquiry form on an online platform through Vermont AYC's website. Once the general eligibility has been confirmed, participants are directed to a full application where they upload current loan, education, employment, and payment information in an individualized online account. If an application is started but incomplete or denied, program administrators will reach out to the applicant to provide additional information to resources, other programs, or provide technical assistance in order to complete the application. The $4,000 for each yearly award is distributed in 4 quarterly payments. Each payment is preceded by an attestation form through the online portal to confirm employment status is continued and financial need is still high to encourage workforce retention. At the end of each year, participants will be provided an opportunity for feedback, which will provide the state with participant demographic data and information around the individual impact of the program that will guide adjustments to this program long term. Next slide, please. Thank you. This is Vermont's first student loan debt relief program for early childhood educators and fills a need for student loan support for educators working in regulated, privately operated childcare centers and family childcare homes. In addition to providing financial support for those who qualify for this state program, even prospective participants who do not qualify, this program really provides a communication pathway for anyone in early childhood education workforce to receive guidance and information on additional resources regarding student loan supports. This includes information around federal forgiveness programs like the Public Service Loan Forgiveness, and along with the extension and the waiver information, information around the upcoming federal forgiveness programs, as well as providing supports for understanding different loan types and different repayment plans like income-driven repayment plans, available scholarships, and other financial support resources. This connection through the Student Loan Repayment Assistance Program therefore provides not just direct supports through financial payments to qualified participants, but also support in the way of guidance and resources to navigating the burden of student loan debt. As of the end of August, the Student Loan Repayment Assistance Program has awarded $162,129 over its first 4-month period. This encompasses 42 active participants, with 85% of current participants expected to return for a second year of support due to loans over $4,000. We currently also have 2 peer ambassadors, which are current program participants who help spread the word of the program across the state and assist other interested individuals in applying. We have reached over 15,000 people through marketing and outreach efforts, including 2 webinars focused on understanding loan types and payments, and a breakdown of how the state program works, which continue to receive views through the Vermont AEYC website. Next slide, please. Due to the fact that the Student Loan Repayment Assistance Program is directed by legislative initiative through Act 45, this program is more likely to be an area of focus for funding priority long-term. Our state has a lot of strong advocacy, which also encourages political recognition of the early childhood education system's essential but struggling workforce. We feel confident that the Student Loan Repayment Assistance Program will continue to support early childhood educators in overcoming their student loan debt challenges and will increase knowledge and understanding of the variety of state and federal resources that support higher education and reduce the student loan burden. Next slide, please. And that's it. Thank you all for inviting me to speak today. It was great to hear other speakers and all of this great information. I think I will be able to provide resources in the chat. And if you have any additional questions, please feel free to reach out. Thank you.
Thank you so much, Natalie. We certainly appreciate all of our speakers and panelists today to share the work that they're doing. Also, don't forget, for those of you who are listening, you're working on amazing initiatives as well. And if you have resources that you want to put in the chat for your colleagues to look at, everyone will be appreciative of that. So please continue to use that chat robustly. So just so that you know, you can always get additional resources and links to everything we've been talking about, especially regarding the recent information memorandums and information about upcoming webinars through the Office of Child Care and the ECD websites. I think Ashley's going to throw in the chat box right now the link to get to additional resources on our curated website. At the beginning of the website, you're going to see just a list of really a lot of things we talked about today. Some of the new programs that are coming up, the new funding, resources about how you can spend your dollars. And then towards the bottom, you'll see these tiles that will direct you to some curated resources by topic, including some examples of strategies that states, territories, and tribes are using to support the workforce. Next slide, please. I also, on every webinar I'm on, I try to make sure that we talk about this particular resource that shows the state and local efforts to pay early educators and provide benefits through this database that Berkeley has set up through the Center for the Study of Child Care Employment. So again, it just is a great resource as you're sitting with your team and your colleagues thinking, what are our possibilities? You can scroll through this resource and see what other people are doing. It might just spark a, that sounds like something we could work on, and now we know who to contact. Again, remember that if you want to do some peer-to-peer discussions with your colleagues, you can set those up through your CCDF administrator who will work with the state system specialists to set up peer-to-peer consultations as approved. And our next slide. So I think this slide is important because the passion on this call, over 1,000 of you on this call, is contagious. So as you're thinking about all the different ways in which you can support the workforce, you might want to think about these 3 buckets and just really think about how can I leverage some of these opportunities for my state, territory, or tribe. I know that Janice did a good job about talking about how she worked with Blue Cross Blue Shield around leveraging for health insurance for Head Start. And so that was one example that we had today. And then, of course, Vermont's work on student loan debt relief. And then so excited to hear about Kentucky's work on child care benefits. But remember, there are many opportunities and many ways to support the workforce. So this kind of just gives you some big buckets to be thinking about and to be advocating for. And I hope there are a lot of providers on the call today. And so I hope that you are using your voice and stepping into the conversation and providing some of your ideas to your leadership and participating in opportunities for you to share your thoughts. Next slide. So again, if you're looking for more information, we love sending you the links to Research Connections that provides you a lot of curated resources on kind of a research perspective on some of these initiatives and how they've been leveraged. So we really thank Research Connections for always working with us to curate some resources on different topics. And again, that link to the Office of Early Childhood Development's website. When you receive the PowerPoint, all of these links are live, so you can click on them. But we'll send in our follow-up email to all of you a list of some of the links that we've also been putting in the chat, so you have those at your fingertips. So you'll have the PowerPoint with the links, and then you'll also get that in the follow-up email. So be sure to check those out for additional information on these topics. Again, I want to thank our panelists so much for joining us. I want to thank Katie and Ruth for always being willing to get on these webinars and share information as quickly as they can around initiatives that are supporting our workforce. I want to thank all of you, 1,300 of you, 1,300 of you for joining. This webinar will be available so that you can listen to it again and catch information that maybe you didn't catch in the first round. And again, make sure you're checking out the websites and the links. Don't forget to register for the PDG webinars that are coming out. We have an OHS webinar that's about to come out. We're throwing those links in the chat for you. That's where you can really speak to some of the experts on some of the questions that you were asking about PDG, renewal grants, and the OHS opportunities. So don't forget to join those webinars. Again, thank you everyone for participating, and we hope you have a wonderful and safe rest of your day.